Yeah, yeah. Hmm. I wanted to come online. It's the first time that I've been online in, I don't know, since Thursday. I was ready for my CAT scan on Friday, and the facility called and said, "I'm sorry, but your doctor didn't get authorization for this." And I'm like, "Authorization? For a CAT scan?" She suspects something wrong with her. I do. And we need to CAT scan it in order to find out. And you have to authorize that? It's like, what kind of pre-certing do you do? So anyways, I went over to her office to find out why they had all week. I suffered for an entire week trying to get to that point. And, well, they don't have an explanation. And the doctor can't see you right now. You can make an appointment. You know, like, I'm like a drug-seeking scumbag. So I said, well, I'm not leaving your office because I have chest pain, and you need to call EMS right now. Okay, sir, we'll do that. So about 10 minutes later, I'm sitting there. She goes, "Sir, EMS isn't really answering." Yeah, isn't that right? I said, 911. Dial 911 and they'll answer. And she goes, "We can't do that. We're not authorized to dial 911. Signs everywhere that say if you're having chest pain, it's an emergency, go to the ER. Well, if you want to go to the ER, call 911. My insurance will cover it." So, as well, I screamed at her. I said, "You dial 911 now." "Sir, we have things to do here." So, 20 minutes later, you know, the EMS shows up. And they take me over to Memorial Hospital, which is the oldest hospital here. And they brought me in, and I had to go through the whole process of, being triaged and who's more priority and whatever. So they take me over because I'm having cranial pressure and I can see lights in my eyes. They go ahead and rush me off to get a CAT scan. And they do my brain and they don't see anything. So they said, "Well, we're going to have to do your chest." And once they did, they go, "Oh my God, there's a mass under the sternum. And it's putting pressure on everything." But it's not only a mass. Now they're finding out that, because I have a swollen lymph node, and it's choking me, that what they saw was what they think is an embolism on my right side, on this side over here. Same side as the big swollen mass on my neck. So they said, "Sir, we can't handle you here. You're going to have to be transferred to another hospital." That's fine. That's fine. I'm fine with that. So I spent the whole night from Thursday evening. It was daylight when I went in. All the way that night until 7 a.m. And I called Jeff, said, "Come on over. Bring me some clothes." And I'm waiting for transport. And they're going to take me to El Paso to a hospital called B-Celll. So finally they get me up there to the one in El Paso. Let's see, in the evening. It takes another whole day. So that's how long I spent in the ER trying to get there. And so Friday evening, around just as the sun was setting, they got me to B-Celll. They didn't pussyfoot around. No, they did not. They rushed me in and they CAT scanned my chest. They did not see an embolism, but they're seeing something else. And they see the mass, interstitial mass under the sternum. So they checked me in, and I've been going through test after test after test. Sorry. Uh, all the way till last night. I got home last night, about 8 or 9 o'clock last night. So, because all they're doing now is just drugging me up. I have, what's the name of that stuff? Hold on, Dargo wants in. Sorry about that. It's very difficult moving around. And so, I got it's ironic that I wanted a CAT scan on Friday, and I ended up getting a CAT scan on Thursday with those guys up there in Memorial, and then another CAT scan on Friday. And so they put me into ICU. They put me in ICU for 2 days, and I had an attack. And I didn't know what it was, but it was so painful, and it was right in the center of my chest on the right side, where that embolism is. And I asked him, what does it feel like when an embolism blows? And exactly as you're describing. The pain, you're screaming, you can't take a breath. Well, then they take me in, and they do a bronchoscopy, and they go into my lungs, and they do a little lavage therapy, trying to move things around as they go through the lung, and they see a mass, but they can't get to it to take a biopsy. They really wanted one from inside, but it seems that my lungs are, here we have the grouping of lymph nodes. The lymph nodes are branching and setting forth new lymph nodes, and branching and setting forth new lymph nodes. So it's encasing my lungs in lymph nodes until it finally can't breathe, till I finally die. So they said we have to go after this lymph node here. I'm sorry. And sure, it's the only thing I can take in. Because of the bronchoscopy, they raped my throat, which of course is normal. And they tore my lip up trying to get the thing in my mouth. And so I can't swallow hardly. And I had to refuse food, so I didn't eat for the first 2 days. And then by the third day, I did eat a little. By the fourth day, I finally had a little bit more, and then that's it. Then I couldn't eat anymore. And so I've been just taking an Ensure as I can, just to soothe me. And it stops the nausea. So finally they come and they did the biopsy on my neck, which is normal because it's the most apparent growth I have, and it's growing fast. And they did 6 core samples, and it's B-Cell type, so it's the most aggressive form of lymphoma. So it's spreading fast. But the only thing they can do now is release me back to my PCP, the wonderful, wonderful PCP that wants to stand in my way because I'm nothing but a drug-seeking piece of shit, whatever. And so I have to go and see her today and ask for a referral to an oncologist who is in plan, but she's got to authorize it. She's got to get it authorized. It's not that she authorizes it, that she has to get it authorized. She can't play around, she can't pussyfoot around like she did to me a week ago. No. It is too late. It's too late for that girl. So that's what I'm doing today. I'm going to her office, and I have to be in a different frame of mind. I can't get excited. If I get excited, I can't breathe. And if I can't breathe, that's it. So, and if I start choking, it's over. So I'm on meds that stop me from coughing. I'm on morphine. So I'm on morphine, and I have to monitor it myself. They tried the oxycodone because they needed me to be on pill form, not injectables. The morphine I was getting was injectables, and the trem, whatever it is. And so we're trying to figure out what's the best drug that works with me. And so I tried the oxycodone, but then I went into hallucinations. And the doctor's like, well, don't you like that? No, I have to go home. I have to function. I have to think. I said, this is so cerebral. I can't deal with it. You know, seeing birds flying around in the room. So he put me on morphine. Yeah, and to control the pain. So I can only lay on my left side. And already since they lavaged me, I can feel the nodes moving, because now they're under the arm. So it's really hitting me on the right side, all the way through, and pretty soon it's going to go down to the lower portions. So it's going to stick within the lymph node system. It's not going to go metastasizing, but it's possible that it could wrap around an organ. My liver's on that side, and it could cause trouble. So anyways, today is the 8th, right? Let me make sure. Lose track of time. And the days. I haven't even washed my hair since last week. I used their no rinse shampoo at the hospital, and it's really nasty stuff. Oh, today is the 7th. How about that? Okay, 3/7. Well, 3/11, because the year is an 8. 3 and 8 make the 11. So it's creative power, time, creative power. It makes fire, like the illumination of a message upon the day. So there's an angelic message upon the day. It looks like my screen doesn't want to focus. And yeah, that's a number 9 spirit. So the spirit's with me today. And the room they put me in ICU was room 233. No, it wasn't. It was 223. So the reverse of the 322. And then when I finally got to getting my biopsies, that was a 332. And I was like, oh my God. So I had some energies watching out for me. And I must say that's a beautiful hospital, B-Celll. And they're wonderful people. Everybody was hugging. The doctor held my hand because he tried to talk to me about lymphoma. And I said, I've been watching a lot of videos. And they loved my optimism. But it's because I'm not dead yet. You have to remain optimistic until you're dead. So it's nice to be home, but it's very disrupted. The dog doesn't understand why I don't want him on the bed, and they want to go back into their regular routines, and it's over. Yeah, here I am going to answer the door, but he does need to go out and pee, and that's it for the morning. I'm not feeding the cats early. Jeff can get up and do that. Now, I don't know what's up with Jeff. He's taken a sabbatical, I guess. He's working from home. That's what he said. I'm working from home until this is over. So I don't know what that means. So I can only put faith that he's doing what he needs to do, what he believes is the right thing to do. And let's see, what else can I say? So it was exactly what I thought it was. Yeah. And it's exactly what I was describing to her. And it's not that I want to make this doctor eat crow. I want her to step up. Step up, girl. It's time you prioritize. It's time you triage this properly. You can't be treating people like that. You can't be expecting, oh, well, isn't he pretty with his long hair and living on Medicaid, that he should walk in here and waltz in here and say, I want this and want that. No, I described it to her. I told her what research has said counters what she says. And so that makes her a big fat liar. And so she has to save face. And so hopefully today will be saving face day. She can apologize. That's fine. I'll accept. The only thing is I need a referral right away to a specialist. I don't have time to sit here and dilly-dally with you, girl. Running me back and forth is just the most ridiculous thing in such a situation. And the oncologist can see all the work they've done, and physically see the condition I'm in, and go aggressive with the radiation right away to reduce the size of the mass, which will give me great relief. And once I have that sort of relief, then I can eat and I can function. It may take a while to get my strength back because I'm walking like a little old man. I can't believe that staying in bed for a whole week, 7 days in bed. 7 days. And they had me under a fall risk, and yeah, so. And I had to be put on a puree diet like an old person. And they gave me some kind of gravy on potatoes with broccoli, pureed, but the white meat was not chicken, it was fish. And I haven't eaten fish since 2008. But I then I was so hungry on Sunday that I ate. And oh my God, it was by 9 o'clock at night, I was vomiting. I threw it all up, and then I was dry heaving. And that was just miserable. Once you go into the dry heaves, it's just miserable. And so it's more of a self-contained, you have to pull it in, you have to control it, you have to hold yourself within. You can't just let it go out, because you're just not bringing anything up. And you have to try to shut it off. And they wanted to keep giving me anti-nausea medication. And I told them, no. Give me some Ensure, because this soothes me. And it does. It works. There must be something in it that cuts out nausea, which is nice. And so, and when I got dressed to get discharged last night, and they took off all my leader lines, and everything that's plugged into me. And as soon as she put a Band-Aid on this one, and I put my arm down, my arm was going, but no one noticed. So we're going over paperwork, and next thing I know, it's pooling. Blood is pooling across the bed. Oh my God. So she had to take me up again and clean everything, and that shirt's probably ruined that I was wearing. I don't think I'll get the blood stain out. And not that I really care. I don't. So that's my update, and I hope that came through. I just want you to know that it's the B-Cell type lymphoma. And so from here, let's hope that the oncologist is a kind person. They have to see people die every day, probably. Or at least to form a relationship with individuals who are about to die, and hopes to help them. And I don't know what they're going to say. They're going to say, you have 6 months to live, you have 30 days to live. Because it's not dropping back. It's not stabilizing. It's advancing. And even this morning, I tried touching this side of my neck, and sure enough, I could feel it. The pain is setting in. And then when I had the lung cleared out on the right side, and it's already in the shoulder. I can feel it under the arms. So it's hard I can't take a deep breath. I'm shallow breathing. And my oxygen levels dropped, and they were real scared of that, and so they put me on oxygen for a while. And that gave me a bloody nose, because, you know, I have a big old nose. But it's because they weren't running a moisturizer, they were just running it dry. And I'm not used to that. So, old El Paso. Some of the nurses were fun. And some of the nurses were assholes. Not assholes. There's one big guy named Gabe. Comes walking in. I'm your nurse. Loud as shit, talking to me like I was deaf. Is there anything on my chart that says I'm deaf? So he comes back later to give me drugs, and he's pound, 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 pound on the door. I said, you don't have to knock. Please don't knock. Just come on in. You're not going to catch me doing nothing. I'm stuck in bed. Just come on in, honey. And sure enough, 11 o'clock, pound, 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 pound. And that races my heart. Once it races my heart, I can't. It takes me a long time to catch my breath and to calm down. And that's why I have to really be careful with this doctor. She had my chest flying, fluttering, flying the last time I spoke to her. For not listening to her patient. And so, yeah, I told him, I yelled at him. I told him, no more knocking, that's it, it's final. And I said, you will put a note on the door to remind yourself. And I said, and if you don't know, I am here for you. You are not here for me. He didn't understand. He probably is still trying to figure it out. Big old brute. And then he told the nurse the next morning, oh, he hates me. Well, no, I don't. You're just a big brute. It must be nice to just stampede in a room by yourself. Cause a stampede by yourself. I tried to explain it to him. I said, you know, if someone knocks like that, you think it's an emergency, you have to get up and answer, and your heart just shoots. I said, if you just walk in, I'll hear you. I'll wake up. It'll be casual. My heart rate won't go up. I'll just boom, boom, boom. I'll talk nice to you. You talk nice to me. I'll take my meds. I said, if you have me scheduled for meds, you wake me up. You don't bypass that. You wake me up for my meds so that they're on time. And I'll go right back to sleep if I can, because I don't know if I did sleep. I mean, I slept last night. Me and Tobit had a little way of doing it where I would roll and he would snuggle. And then I would pull the covers of him away from me, fall back on my back, and then roll, and then he would snuggle. And we did this all night. Yeah, in order to stop the pain across my back. Yeah, because I can't lay on my back. Sitting up is much different, because all the gravity pulls everything down. But when you're laying on a flat surface, oh, it's like everything wants to flatten out like a pancake. There's no more room. Yeah, there's no more room. So that was the angelic message for today. Hopefully she will come to her senses, and I can apologize if she needs, kiss her little ass. And she can apologize if she doesn't want to. It's no big deal. As long as I have a referral in hand, but I have to have authorization right away. There's no, we'll get around to it in 3 days. No, you triage this immediately, because I'm headed right over there right now. You triage this and for authorization, so I can walk in the oncologist's office and get started. Still know what to do. They deal with this. It's just protocol keeps the patient at bay through liberal socialized medicine. And the difference between a red state, El Paso, and a blue state is phenomenal as far as that hospital there. And that's a privately run hospital. But they still take Medicare patients. They have to. They have to take, or Medicaid. They have to take a certain percentage from the population. And so I just make their numbers step up because then. But now, will she authorize all that took place? Well, she's going to have to. And she's going to say, no, they have to do that. They have to call. Well, fine, then they'll figure it out. But I had to pay cash for my prescriptions last night because B-Celll didn't get authorization through this silly insurance. That's the Medicaid, their way. It's like, okay, that's sick. You're taking the low-life patient and you're expecting them to step up like the average person. And if they can't do it, well, then just go home. We'll give you a month. Call us when you're ready. That's so sad. So sad. Because there's no reason why I can't live for another 10 years. And when I reach that 10-year mark, there's no reason why I can't anticipate another 10 years if I change my ways. So, of course, there's no marijuana smoking at all. Any smoke is out of the question. And I went through respiratory treatments over and over, and I do have my albuterol inhaler, which is like baby medicine compared to the medicine they have at the hospital. So what good is it? You know, you had to go through all this rigmarole to get me albuterol because they have such control over it, because it's making so much money and those people need it. So yeah, we'll just hold it. It's not the same as what they're giving in the hospital. It's the greatest stuff. So to clear me out, and I'll be in bed before you know it. That's why I'm looking at it like, but it's very hard on my hips. It's hard on my bones. It's very difficult. But so far so good. I'm sitting up, and but I'm going to get exhausted doing this. And of course I watched Psychic Sounds by B, and she said the same thing. You know, this has to be triaged. People are going to have to step up. People are going to have to save face. It's like, yeah, isn't that true? I got my diagnosis. And it's the hardest thing. When I explained it to them at B-Celll, they understood. They said, oh my God, isn't that terrible? It's like, no, you know your body better than anybody. Why would anybody put themselves through that just to get attention? Why would they do that just to get drugs? It's like, I don't know. Maybe the OxyContin is one of the options that they can get a hold of. So they go this pretend route that I can't breathe, whatever. And she's just not looking at the signs. Yeah, because it's not going to show up in my blood work. No, and they doubt that they're going to show up anything on the tissue they took from my lung, because that's just the generation of new tendrils of lymph nodes coming through and embedding themselves. So what are they going to show? New growth? Yeah, like flowers and trees. So, you know, they're going to have to stick with it, having taken the six loads out of this thing. Yeah, and I still have a bandage. You can see this; it's still bandaged. It's pretty big, and it chokes me. I don't think there's anything else to say. Goodbye. It's been fun. Thanks for all the fish. Yeah, they had that fish, and I just vomited it all over. Well, I contained it, but oof. I'm not meant to eat fish. You know, how can you live in the desert and say fresh fish? You know? You can't. You know. So that's the first time I've been to El Paso in a long time. Yeah. And it was nice to see the difference between the red and the blue. How shameful the blue has become. How greedy, shameful, sick. And I think they're still pushing Biden as if he's as if he's capable of anything. So no, the whole party is not capable. They won the lottery by winning a fake election, through the Dominion machine. They won the lottery, and now they can spend. And look at, we're already broke. They have to push the debt limit, and push it on people so that they can have their toys, and they can have their fun, and their cake, and they can eat it too. It's so wrong. I hope now that Trump is taking this landslide sweep, that it reveals all these things, but not only that, that we finally take the Constitution and we open it up and we arrest the enemy within. And forfeiture is very important because that's all our money, and it should be used to pay the debt down. Let them get on the street and join the Medicaid group that we are. Yeah. And start things over. I'm amazed at how many businesses are operating in El Paso. It's like a whole different world. Every corner is shop after shop after shop. There's so much hustle and bustle. Everybody's got brand new cars. Things are going. But here? No. Here is empty spaces. Empty spaces. So, okay. Have fun. Be good to yourself. All right?